All right, guys, so for this go around, we're going to be talking about the tissues and its functions. We're also going to be looking at the things that compose tissues, the different types of tissues found in the body, and what that actually means. All right, so for tissues, so they have some different functions. So we have protection, permeability, secretions, and sensations. So tissue, especially our skin, it provides a type or a layer of protection. So it's going to protect us from external and internal services from dehydration, abrasion, and destruction by physical, chemical, biological agents. So essentially, it's going to protect us from our moisture or the water leaving our bodies. It's also going to be able to protect us from being scratched or if we rub up against something that's very harsh to our skin. It also is a physical and chemical barrier, so it protects us from chemicals from the outside world or biological agents. So how I always say it is, our skin is essentially our first line of protection. It's going to protect us from the outside world. It protects the inside of our body from the outside environments of our body. It also has selective permeability, which means that it allows for promoting or assisting the passage of ions and molecules. So epithelial tissues essentially act as the body's gatekeepers. So it allows things to come in or stay out, or vice versa. Some tissues are capable of also producing secretions. So think about like your saliva glands. Like mine are dry right now from talking so much, but they produce secretions. Think about the urethral tract. It produces secretions. Um, your kidneys and your ureter tubes, those all produce saliva, not saliva, but secretions. Um, your stomach, your stomach produces acid, so that's a big secretion that it produces. So some different tissues or different cells produce different things. Sensations, epithelial tissues have a lot of nerve endings. So if you remember from chapter one, when we talk about how for something to be classified as living, it has to be able to respond to stimulus. So nerves are a way that we are able to respond to stimulus, or tissues are able to respond to stimulus. And so they're able to determine touch, pressure, temperature, and pain. So when it's cold outside, we can tell if something's hurting. We can tell um, if I'm being touched, whether it be lightly or something's pressing hard on me, or if you're even blowing on your skin like this. You have different receptors for each one of those things I just named that are going to be able to detect those different types of things. So that's all the things that we can find in tissues and primarily our skin, really. Another thing that our body produces is mucus and secretions. So that's produced by gallbladder cells, which you'll see a little bit more here as the chapter goes on. But different cells produce different things. They have different structures, have different functions, and so that's what we're going to actually get off into this chapter here. So simply, like, we have to start at the base layer though. We have what's called simple epithelium. So simple just means it is one layer. It's only one layer thick, and underneath that layer is called the basement membrane. So think about with the basement with a house, you have that at the very base of it, and then you build on top of that. So the basement membrane, especially for skin or tissues, is going to be that very layer at the very, very bottom. And that's the one. Then the layer above that would be the cells, or the lateral surface and apical surface. So simple just means it's just one layer. Now stratified is where there's several layers. So right here, you can see that we have several layers, but here is just one simple layer. So we see this in skin. Now over here we have some different classification of cells. So we have squamous, or squamous, however you want to pronounce it. That is kind of a flat cell. it can kind of be it's irregular shape sometimes. It can be kind of sometimes you can find them kind of squarish or circle, but usually they're going to be kind of odd shaped. Now cuboidal, it looks like cube, and actually kind of does look like a cube in its shape, but instead of it being sharp edges, they're kind of rounded. And then you have columnar, which they're columns, so they're more longer than they are wide. So there's the kind of the basics of tissue shapes and sizes and the formations, whether it be simple or stratified. So you can have stratified cuboidal cells, you can have stratified squamous, you can have stratified columnar. So just stratified just means that it's just many layers thick. Simple just means it's just one layer thick. Now you have what's called pseudo-stratified, pseudo meaning false and stratum meaning layer. So pseudo-stratified means that they're going to be kind of at different intervals. So you may have one that's here, they have one that's here, have one that's here, one that's there. They're still stratified, but they're not all even or straight across. They're going to be kind of zigzag, but they're going to be in several layers. Um, so here are the different types of epithelium. So you have simple, which is just one layer, then you have stratified. Now, in simple, you can have simple squamous, like I said earlier, simple cuboidal, columnar, pseudo-stratified, columnar. And then in stratified, you can have the same thing, but with stratified squamous, you can have what's called keratinized or non-keratinized. Remember, keratin is a protein. It's a strong protein that we find in usually hair, skin, and nails. With keratinized, that means that the cells are dead. And the reason why we have keratinized cells are essentially for protection. So like the palms of our hands are going to have keratin, as well as kind of the back of our hands, because it is for essentially to protect us from abrasion. Um, there are some squamous cells that are non-keratinized, which means they are still living. So like on the inside of our cheeks, that is referred to as stratified squamous, but all those cells are still living. They're not hard or rough like our skin. So if you feel on your skin, it makes that sound. On the inside of your jaw, it does not. So those cells on the inside of your jaw are living. The ones on the outside are not. Those are dead at the very surface. So the ones that are living are non-keratinized. The ones that are on the outside of your skin that are dead skin cells are keratinized. Another one that is not listed in simple is going to be transitional. So transitional, it sounds like what it actually does. They actually transition. They actually are able to stretch. And usually we only find those within around the kidneys and the bladder. Because remember, your bladder fills up and it's able to stretch. That's why we have transitional cells in the bladder, so that they can stretch and so that they can hold more. Just imagine if we didn't have transitional cells, your bladder would be kind of full really quickly. You wouldn't be able to hold it. It was kind of, once it gets full, it would have to expel. We can hold it and it can kind of stretch a little bit, and we can hold it for a little bit longer. But without transitional, we won't be able to hold it very long. So here we're going to actually go through some different tissue types. So here, this first one here is going to be simple epithelium. So this is what the purple one that you're seeing here is what's going to look like underneath the microscope. This type of epithelium, it's simple, which means it's only one layer thick, and we're going to find it in our lungs. That's why they have a picture of the lungs right here. And more specifically, they're going to find it in the alveoli of our lungs. Since it's one cell thick, it's very thin. And so because it's only one cell wide. With that being said, that means that it doesn't take much for oxygen and other nutrients to pass through them. And we want that for our lungs. We want to be able to exchange the oxygen that we're breathing and the gases that we're trying to give off. We won't be able to get rid of those pretty quickly. So a lot of simple diffusion can happen within a simple epithelium. So if they're thin, it makes it very easy for things to pass through them. If it was stratified, which means it was several layers thick, not much is going to be able to pass through them. So in our lungs, or in the alveoli of our lungs, it's going to be very, very thin and allows for oxygen and other gases and blood to pass through a lot easier. In this one over here, we have what's called simple cuboidal. Simple, again, means one layer. Cuboidal means that it is in a cubed shape like fashion. We're going to find these in the kidneys. Remember, cuboidal cells are going to secrete. That is their function of cuboidal cells, which gives us a good definition of what that looks like underneath here. So its function is to absorb and for secretion. And you're going to find this in the lining of the kidneys, thyroid, surface of the ovaries, and some of the exocrine glands. So remember, cuboidal is for secretion. Then we come down to non-ciliated, which means it does not have any cilia. From last chapter, we talked about cilia being hair-like extensions, which is going to cause pushing or locomotion, pushing or beating of objects, especially like mucus or the oocyte, which is the egg. So here we have non-ciliated simple columnar epithelium. This is going to be for absorption and secretion as well, but these are going to be found in the lining of the gastrointestinal or in your stomach. So that's why they have a picture of the intestines right here. So you're going to find this, or non-ciliated simple columnar epithelium, you're going to find that actually in your intestines, and that's for absorption. So that's what we want to have. We want to have microvilli in our stomachs or in our intestines so they can absorb those nutrients. That's where they get absorbed. Over here we have ciliated simple columnar. So ciliated has those little hairs, and that's what I was saying right here. It has those little hairs that are right here, and that's what's going to push mucus and things of that nature. So when we come down to the function, it's for secretion of mucin, which is essentially the dehydrated form of mucus. So once mucin gets hydrated, it turns into mucus. So these are also going to be located within the esophagus, within the trachea, and within the fallopian tubes. And like it says down here, within the lungs and the uterine tubes. This next one down here is ciliated pseudostratified. So pseudostratified means that there is several layers, but you notice that they're all kind of like stepping on top of each other. They're not very well organized. So that's what pseudostratified means. Pseudo meaning false, but stratified means that there's several layers. So here you still see that there are ciliated, but here you also see what's called goblet cells. Goblet cells, how I kind of remember is like when I spit up a glob of mucus, it's a goblet. It produces mucin or mucus, really. So you're going to find this type of tissue within the pharynx, larynx, trachea, and bronchi. So in your respiratory tract. So if you think about it, where do you produce mucus? And a lot of it, it's going to be in your respiratory tract. And the reason we do that is so that it can trap pathogens or contaminants that are in the air we want to get rid of. So mucus is really sticky. So when all those pathogens come into our nose or our mouth, as soon as it touches the mucus, it is stuck there and doesn't allow it to go anywhere else. So when you blow your nose, it pushes out that mucus, and so it pushes out those pathogens too. So it doesn't get, trapped inside the actual body. It's able to expel it. The next one over here, which is going to be non-ciliated pseudostratified columnar. So if we zoom in here, again, it's pseudostratified, so it's non-ciliated, which means there is no cilia. And we look here, there is no cilia, but it is pseudostratified because you see they're all kind of like stepping on each other, and they're all covering one another, kind of fighting for space. So these are going to be found, well, this is for protection, but this is going to be found more specifically in the male urethra. So usually only males have this type of structure here. Now we've left simple meaning one layer. Now we're in stratified. So stratified means that there are several layers. So here we have keratinized stratified squamous epithelium. So let's break that down because that was a lot to chew on. So keratinized means that these are going to have some dead cells and it's going to be for protection. Stratified means that it's going to be layered. Squamous means that it's going to be kind of squarish. And epithelium just means that it's on the skin or on the surface. So that's how we had to break this down, even though it's a long sentence, but each word tells us the location and its function. So keratinized stratified squamous epithelium is going to be located on the epidermis of the skin. Remember, keratin is rough, so it's going to be on the external surface to protect us from abrasion in the outside world. So that's its function and its location. Remember, keratinized is rough, stratified means layers, squamous means square, and epithelium means epi means above, and thelium is referring to skin. So for the next one, we have non-keratinized stratified squamous epithelium, which is the opposite of the one we just did. So that means that there's no keratin, which means it's for softer tissue. So remember, we're going to find that in the lining of the oral cavity, so like on the inside of your cheek, inside your throat, which is the pharynx, your larynx, which is your voice box, your esophagus, which is where you swallow food down, on the inside of the vagina, and the anus. That will be where you would find non-keratinized stratified squamous epithelium. Now, we have stratified cuboidal epithelium. Remember, stratified means layers, cuboidal means cube, and epithelial means referring to the skin. So the function is protection and secretion. Anytime you see cuboidal, that means secretion. Also, we're going to find this in the ducts of most exocrine glands and ovarian follicles. So in places where we have secretions like certain glands like our pancreas or our thyroid, that's going to secrete a type of hormone, or any secretion in general, is going to be cuboidal, but it might depend if it's going to be simple or stratified, but it's always going to be cuboidal if there's going to be secretion. For stratified columnar epithelium, stratified again meaning layered, columnar meaning that they're going to be in columns. Epithelium, again, it's going to refer to the skin, which is what you see right here. They're column, which means that they're long like columns. They're going to be for protection and secretion, but they're going to be found in large salivary ducts. So the secretions that your mouth makes, especially like when you smell food or when you sleep and you drool, those are glands. Also conjunctiva that cover your eyes, so the inside of your eyelids. So if you look at the inside of your eyelids, that pink that you're seeing are actually these. You're actually seeing a bunch of these put together. And it's also lining of the male urethra, so the part where that we actually urinate out of. That's why they're showing you kind of a bladder picture here. On the inside of the urethra, that is also where you will find some stratified columnar epithelium. All right, this next one here, which is one of my favorites, is transitional. And if you take a look, all those cells are kind of different shapes. It's because they're able to stretch. And one thing with our bladders, we want them to be able to stretch apart and contract, and actually be able to store a lot more urine, especially if you need to be able to hold it for a long period of time. So transitional is the only one that actually looks like this. And the function is to accommodate urine volume changes. And it's also going to be found in the lining of the urinary bladder, ureters, and the part of the urethra. So this will only be found in the bladder. So anytime you see cells or tissues referring to the bladder, it will always be transitional. So here we have what's called endocrine glands and exocrine glands. Endo, remember, it means in or inside, which means endocrine glands lack ducts. So they don't have like a tunnel to shoot their hormones out of. Think about if you were to essentially dig a hole or dig like a very narrow hole, that would be a duct. They would have somewhere where it can push its contents to the outer surface. That would be exocrine. Endocrine glands don't have that. Endocrine glands have to kind of secrete their hormones into the bloodstream in order to get their hormones to be circulated, or they have to kind of push out their hormones around the cell in hopes that the bloodstream picks it up. Exocrine glands are able to eject their hormones out of a duct. So essentially it has a pipe to where it can send its hormones. Endocrine glands don't. So endocrine glands are essentially like if I were to leave something outside of my door and hopefully somebody would walk by and pick it up, versus me actually having a hallway to go down and actually take the stuff to. So endocrine glands lack ducts. It doesn't have anywhere it can essentially send it off to. Exocrine glands have a duct, and so they're able to actually excrete things. So an example of exocrine glands would be like sweat glands, right? So your sweat glands are on the inside, on the deep side of your skin, but they actually have like a little tunnel that can actually shoot the sweat on top of your skin. Mammary glands, which are what essentially produce milk, those have ducts where it produces on the inside of you, but it can eject on the outside of you. And same thing with salivary glands, it has a place where it can eject. Endocrine glands do not. They have to use the bloodstream to essentially send all their hormones around the body in. And so here's what they look like. So this would be a exocrine gland. So it has a tunnel. So all this cells here would produce a hormone and then it would send it out. Here's the duct. So that would be that little small portion you can send it out of. So there's different types of glands. So you have simple glands, of course, and then you have compound glands. So here are some simple glands. So here you have like a simple tubular gland. So this is like if I was mentioning earlier about if you dug like a little hole into the ground, you'd have like a simple little duct here. You can have simple branched, which it kind of looks like a tree branch, how things kind of split off. You can have coiled where it actually spins. And you can find that more in sweat glands, and we'll see that in the integumentary chapter. You can have simple acinar or acinar glands, which essentially just means that they come down and they kind of make a wide pit. And then you have simple branched acinar, which means that it's the same thing. It has more splitting off of each other. Once you have simple, of course, we can have what's called compound, which means that there are several different types. So with tubular, that just means that it's highly branched. You can have compound acinar or acinar, which means it has a many branching or different branches of acinar. Or you can have compound tubular acinar, which means it's a combination of them both. So they can get kind of complex. But we have different structures, which remember, different structures have different functions. So here are some different glands that we are a little bit more accustomed to. So here we have what's called a merocrine gland. And we're going to find this in salivary glands. So essentially, these cells down here are going to secrete, um, in this case, saliva, and then it's going to push it out of the duct and into the mouth. And so this is what would be referred to as a American gland. So essentially, it just produces um, the chemical or the substance. And if you look closely, here we can see vesicles. We talked about this in the cell chapter. So essentially, you got the nucleus that's right here. Those vesicles are going to be producing the saliva. Those vesicles are going to move towards the cell membrane or the plasma membrane, fuse with it, and it's going to release its contents. And then that's going to go up into the duct and then go out into the mouth. That is American glands. Now let's look at apocrine glands, excuse me. And this we actually see in the mammary glands or in the breast tissue. So let's look a little bit more closely. So here we see that for this one right here, we see that it's actually pinching off. So like the cytoplasm, so part of the cell is essentially being pinched off. So let's look at if we took a balloon and we started pinching it, and then if we were able to pinch off that piece of that balloon, that becomes part of it. So here we actually are seeing the cytoplasm being pinched off. So all these secretions are actually part of the cell that has been pinched off of the cell. So it's actually pieces of the cells leaving and being given off. So milk, the thing that we like to drink with our cereal or eat with our cereal, is actually pieces of it is actually part of cells that have just been pinched off and given away through the ducts. Also know that, remember, these are glands, and a lot of these are kind of like sweat glands. So milk is actually sweat. It's just modified sweat. That's one reason why you can actually kind of sweat from your armpits. Well, not sweat from your armpits. You can actually secrete milk from your armpits. That's because they're right there by your mammary glands, and your sweat glands are your milk glands are really the same. It's just modified to make milk instead of sweat, but milk is sweat. So more you know. So that was apocrine glands. So the difference is it's actually pinching off pieces of its cytoplasm. Then you have what's called holocrine glands. This is what you're going to find in your oil glands. So in the oil that you see in your skin, in your hair, this is how it's actually made. So what's actually going to happen is that these cells at the very base are going to make more cells, and those cells actually essentially explode. If that's what you're actually seeing here. So you're seeing them like dislodge, and then you're seeing them like literally explode. So that's actually how your oil glands actually work. They're actually little explosions of cells versus apocrine, which is just, they just budding off of it. Holocrine, or the whole thing or the whole cell, is bursting. So how you can always remember holocrine is the whole thing is bursting. Apocrine, I remember because in Spanish, to say stinky is apenstosa, which is kind of spelled like apocrine. So that's how I can always remember what apocrine is. Usually you can also find apocrine glands in your armpits and in the pubis area. That's what actually causes, especially when you turn of age. Usually you start smelling a little bit different. You have a little bit more body odor. That is because those apocrine glands have now kicked in, and they start secreting things that bacteria really like to feast off of. And so bacteria is what's actually making that smell. So essentially, when you become of age, those apocrine glands become a little bit more active. They start secreting hormones and other salts and biological substances that really like to feed bacteria. And bacteria start making a lot more smells. then you have more BO. So that's actually what's happening when you start turning of age or become a teenager or adolescent or out of adolescence. All right, so next is connective tissue. So connective tissue does exactly what it sounds. It's actually going to connect some things, and more specifically, it's going to connect tissue. It connects, binds, supports, and protects organs. So remember, each organ is made out of a different tissue. So if they're out of different tissues, they're not going to connect very well, right? So with connective tissue, they're able to essentially be like a Velcro between the other organs and the skin and other organs that are around it. So it's able to kind of keep them stuck together. In addition to that, connective tissues are typically vascular, but some different tissues of connective tissue exhibit a range of vascularity. So connective tissues such as bones and blood are very highly regenerative. Um, you are actually typically making around about 3 million blood cells per second. So some are very, very rapid. Your bones right now are actually breaking down and building back up constantly because you're needing calcium. And when you got enough calcium, it builds it back up. So you are constantly building and breaking down your body. So some tissues are very, very highly regenerative. Another thing is referred to as ground substance, which is protein fibers in a extracellular matrix. So here is a picture of that. So in ground substance, um, you're going to have some blood vessels, which is what you're seeing this red structure here. You're going to have some protein fibers such as collagen, which is one of our strongest protein fibers that we have, especially with it keeps everything kind of tight and firm, especially when you see wrinkling. That's abundance of collagen fibers. Also, if you have a scar, let's see here. If you can see this one here on my wrist, if you ever get a scar, it's because you cut too deep into, or there was a cut that was a lot deeper into those layers of skin, and by that, when that happens, it causes a lot more collagen fibers. So you see a lot more of these fibers right here start building up, and that's what you're actually seeing. That's what actually makes the scar tissue. Is there's an abundance of collagen fibers. In the cellular matrix or in the ground substance, you're going to have a lot of resident cells. So like adipocytes, which are fat cells, fibroblasts, anytime you see blast, that means that it's building something. So anytime you hear blast, that means building. So fibro means fibers. So we're literally building fibers. So those are the stem cells for fibers. Macrophages are literally cells that go around kind of eating things. I always call the little Pac-Man of cells. They go around and scavenging, eating things that are foreign or foreign particles that are not supposed to be there. So it's a good thing to have that to happen because that keeps from getting infections in these different cells and also in different connective tissues. Because remember, if we infect a tissue, we can affect an organ system, and then the organism. So it's really good to have some macrophages and things to keep things connected, but also keep things from being attacked from potential pathogens. So like I said earlier, fibroblasts are for producing fibers and ground substance. Adipocytes are fat cells. Mesenchymal cells are a type of embryonic stem cells within the connective tissue. So if these tissues become damaged, these cells will divide. Once the cell is produced, replaces the mesenchymal stem cell, they become a committed cell that moves into the damaged area and differentiates into the type of connective tissue that cell is needed. So essentially, that long sentence is just saying that when a cell becomes damaged, a mesenchymal cell will send another cell, kind of like in the army, will send another cell to replace another cell and become that cell. So that mesenchymal cell isn't a bone cell. So let's say you have a bone cell that's going bad, or that's getting ready to essentially break down. A mesenchymal cell will go and take that bone cell's place and become a bone cell, even though originally it wasn't a bone cell. So typically when it comes to cells dividing in general, a bone cell can only replace a bone cell. A eye cell can only replace an eye cell. A skin cell can only replace a skin cell. But a mesenchymal cell can go and become any kind of cell. So that's pretty cool. So in a clinical view, we can kind of look at some things. So here's a deficiency referred to as vitamin C deficiency. So I always tell my students, take their left hand and make a C, because how this was found, vitamin C deficiency was found in sailors who would be out on long voyages or pirates, and they would notice that if they were start kind of getting really sick, and they found out that if they took limes and oranges or citrus fruits, that it would actually stop or counteract those symptoms. So what they classified, or what they termed it as, was called it scurvy, which is vitamin C deficiency. So I tell my students, make a C with your left hand, and I always say it like a pirate, like scurvy, because you make a C. That's how I can always remember vitamin C is scurvy. Like vitamin D is rickets, and that's if you don't have enough. That's if you don't have enough vitamins, or vitamin D, which is vitamin D deficiency. But scurvy is vitamin C. I always make the C sign and say it like scurvy, like a pirate, so that I always remember um, that it's vitamin C deficiency. Um, so you can counteract it with citrus, but you can also counteract it with broccoli, cauliflower, pepper, spinach, and tomatoes, or taking vitamin C supplements. So that's where you can also find vitamin C. We usually say vitamin C is in oranges, but it's actually in other things as well, but it's more prominent in oranges and citrus. So here is what mesenchyme actually looks like. So we can see here, whoops. We can see here we have some ground substance, we have immature protein fibers, and then mesenchymal cells. So they're like stem cells. So they're able to go and fix other cells by becoming them. And so they're located throughout the body of the embryo and fetus. So essentially they are stem cells. They can become other connective tissues. Mucous connective tissue, so it supports structures of the umbilical cord. And this is where we actually tend to harvest a lot of stem cells, is in the umbilical cord. And speaking of umbilical cords, there's research to actually show that if you take the stem cells from umbilical cords, it has the potential of using for cardiovascular diseases or neurological disorders. It has cured 25,000 patients from acute leukemia, which is essentially white blood cell cancer, and then metabolic disorders and leukemia, and lymphomas, which is skin cancer. So, and it's also essentially stem cells can change into any type of cell that you want. So I can take a stem cell and place it by your heart, and it will become a heart cell. I can take that same stem cell and put it by your bone, and it will become a bone cell. So stem cells have the potential to turn into any type of cell that you want it to. And those are really found abundantly in the umbilical cord, because you only started from really two cells. You start from a sperm and an oocyte or egg, and so you have to be able to take cells and then turn them into different things. But typically, when it comes to cells, once they turn from a stem cell into the cell that they're supposed to be, they never turn back. They always are going to be the exact same. So once a stem cell becomes a blood cell, it's always a blood cell. It never can go back to a stem cell. So that's one reason why people try to save the umbilical cord or the placenta, is because they hold, or freeze it, because they want to be able to hold the umbilical cord with the stem cells in it. All right, so let's look at loose connective tissue. So there are different connective tissue classifications. So we have connective tissue proper, supporting connective tissues, and fluid connective tissue. So in fluid, we're going to have our blood. In our supportive, we're going to have cartilage, which is like found in around our bones, especially in between our bones, that keeps them from making friction. You're going to find it in bone. You're going to find it in hyaline cartilage, fibrocartilage, elastic cartilage. Connective tissue proper, we're going to have loose connective tissue, dense connective tissue, whether that be areolar, adipose, which is our fat, dense, regular, irregular, elastic. So we're going to actually look at and dive into what these actually look like. So loose connective tissue essentially supports structures of the organs. It adds cushion to the organs. And we kind of want that to happen because they're all kind of packed against one another. So with areolar tissue, and areolar tissue kind of really stands out because it looks like a bunch of strings of fibers, which they are, because you have elastic fibers, collagen fibers, and fibroblasts. And remember, fibro meaning fiber, blast meaning build. The function of it is to protect tissues and organs, bind skin to the epithelial of the deeper tissue. So if you, in the lab video, you'll actually see me pull areolar tissue. So if you took some raw chicken with the skin on it, if you flip the skin over, that very thin layer, and you can actually take it and actually scoop it up, that is the areolar tissue. It's a very thin tissue. If you look at the picture here, you can even see that it's so thin that light passes through it. But it's a very thin tissue. But it connects the skin to the actual muscle or the meat of the chicken. It actually is a layer in between the muscle and the skin. So that's what's actually going to connect the two. Because remember that the skin is an epithelium, the muscle tissue is a muscle tissue. They're different. There are two different types of tissue, so you got to have a tissue that's going to connect them, like kind of like Velcro. The next one to the right over here is going to be adipose tissue. And adipose tissue kind of stands out because if you look closely, the nucleus is always pushed to the outside. So remember that adipose tissue is fat. So with adipose tissue, it's kind of squeezing the nucleus to the very outside. So it's kind of like pushing, it's so fat that it pushes everything out to the outside of the cell. And so adipose tissue really looks very distinctive because it's the only one that looks like a bunch of white cells with the nucleuses on the very outside. And usually adipose tissue we can find, especially in the deeper parts of our skin, in the subcutaneous, which is also for retaining heat. Also is usually going to be kind of around each organ because we understand that fat tissue is going to provide energy, like we discussed in chapter 3. So moving on, we have dense connective tissue. So this one, how I always remember dense connective tissue is because it looks like lasagna noodles kind of stacked on top of each other. It looks like a lot of waves. They look very organized, but they're kind of stacked in a wavy like um, um, partition or partition, really. It's very nicely organized. And so this is going to be dense, correct, connective tissue. So dense meaning that it's kind of heavy and that they're really close together. And so we're going to find these are going to be located in our tendons. So our tendons, remember, tendons are going to connect muscle to bone. Um, especially like in our leg, like with the Achilles tendon, which is going to connect our calf muscle to the back of our heel of our foot. So muscles, that's how muscles attach to bones. The point of muscles are to actually pull on bones for movement. So it makes sense of why tendons are connected to bones. So when you're eating a chicken leg and you get that little bitty piece that's really hard to kind of chew, that's going to be the tendons. Or if you're cooking chicken breast and you got to move that little strip out of there, that's going to be a tendon. And so essentially its function is to attach bone to muscles or bone to bone, um, as well as muscle to bone to resist stress applied in one direction. So again, it just helps with attaching muscle to bone. That's going to help for movement, but it has to be very strong to withstand that movement. So if you have dense regular, you have dense irregular. So if you look at and compare the two, dense regular, it makes a real nice smooth pattern. Irregular is all over the place. But dense irregular, its functions to withstand stresses applied in all directions, and it's very durable. Also, you can find this in the skin, in the dermis of the skin. You can find it covering nerves. You can find it covering some organs, but where I typically find it most is covering the bones. So in the video, you'll actually see me scraping the bones. So there's a very thin, clear layer that's wrapped tightly around bones. So because it protects the bone actual tissue from the tendons and allows a nice place for the tendons to attach and adhere to. So it makes the outside of the bones kind of rough for attachment purposes, but it also encapsulates the bone itself. It protects the bone from all the other tissues. So each tissue is protected from the other tissues that are around it. So each thing is compartmentalized essentially. And then you have what's called elastic connective tissue. So when I think about elastic, I think about the stuff in like jogging pants and things that make things stretchy. And if you look closely here, that's how it actually got its name. It actually does look like elastic. If you notice all those, they're kind of coiled, but if you pull them apart, you can straighten them out. That is what is actually called elastic. We can find elastic, I believe in our ears. So you also can find it in your arteries, your trachea, and your vocal cords. So things that are having to stretch and recoil. So our arteries are constantly being pumped full of blood, so they have to kind of do this. So they have to be able to stretch. So you have to have some elasticity in there. If you didn't have elastic in there, it essentially would make it very difficult to pump blood through, and also it raise your blood pressure. So if you're a smoker, it actually reduces the elasticity or this tissue in your arteries. So it makes your blood pressure higher because it makes your arteries hard. So if they're hard, they can't expand, which makes your blood pressure higher. Also, again, it reduces your chances of reproducing because your fallopian tubes get hard as well, and they're not able to push that egg to the uterus. So, looking at this clinical view, we have what's called Marfan syndrome, which patients that have this syndrome typically have longer fingers, toes, and upper limbs. They also have malformation of your thoracic cage, which would be your ribs, the vertebral column, as well as excessive growth of your ribs, and will have an easier time dislocating their joints. So this results from essentially attacks cartilage or connective tissues, essentially, which essentially is going to cause a lot of issues, especially within the heart, because remember your aorta is on your heart, or it comes off your heart, which is your main blood vessel from your heart that takes all your blood to the rest of your body. It can also act on your heart valves, which are cartilage. Your heart valves allow blood to flow in and out of your heart. If those don't work properly, you're going to have some serious issues with getting blood to your lungs and to the rest of your body, which means that um, your body's not getting a correct oxygen supply. Also, it's not getting rid of CO2, so it's going to cause a lot of issues there. It's going to cause some vision abnormalities, just because of the thin ligaments that are there as well that keep the eye in place. So your eyes might tend to droop or kind of have a lazy eye kind of thing, or allow the lens in your eye that actually moves to focus light to become weak, so your eyesight would deteriorate. So there are some syndromes that can attack these different types of tissues. So we have to be careful. But if you take a look here, his fingers are really long. So it's attacking the cartilage, or it's affecting the cartilage in his hands. And remember, bones are actually cartilage before they become bones. That's one reason why his hands are longer. So it starts affecting before they become hardened with calcium. They're actually full of collagen and other fibers. And so it acts on them, makes it a little bit longer, and then they get hard, and then they're kind of stuck like that. Also, his joints are essentially really bendy. And so his joints are made out of cartilage as well. So it's affecting that cartilage or that tissue. So speaking of cartilage, there's different types of cartilage. So we have hyaline, which is one of my favorites because it looks very glassy, very shiny. So if you look at the ends of bones, they are very shiny and slippery because that's a cartilage that allows for movement to happen. So especially like your femur and your tibia, that's in your leg, that's right there where your kneecap meets. So this would be like your knee. They're supposed to be able to move and slip and slide like this. That's due to cartilage, so it keeps your bones from rubbing together. Also your meniscus as well. But anytime there's bones articulating or moving with each other, there's going to be some type of cartilage to reduce the friction. And so if you look at the end of chicken bones, they have a very shiny end, and this is due to hyaline cartilage. So the function is to forms most of the fetal skeleton. So when we are babies, all of our skeleton is really not bones. It's really just cartilage, hyaline cartilage. That's why that babies can if they fall or hit their head, it's not as bad because they have cartilage, and it's kind of essentially made to be able to take a sudden blow in case, versus if you're an adult and you hit your head is bone, and so your brain can slap against that, cause a concussion. So babies' bones are a little bit more flexible than adult bones because they're steadily growing. So the location of hyaline cartilage is going to be your tip of your nose. That's one reason why you can bend it like this. Your bronchioles, which is the inside of your lungs, your larynx, which is your voice box, or you can kind of feel it right here where your Adam's apple is, which women and men both have Adam apples, but it's just more prominent in men because of testosterone, so you can see it on the outside, but we both have it. The costal cartilage, which is the cartilage within our lungs. The epiphyseal plate within our bones, that's where, when we get into the bone chapter, you'll see where you'll have cartilage right there where you have a lot of bone growth. And then, of course, in the fetal skeleton. With hyaline cartilage, we have what's called fibrocartilage. And if you can see here, it's actually in between our vertebrae. So we're going to find fibrocartilage in our back. We're going to find it separating the different bones in our back. You want to have cartilage in between your vertebrae because that keeps your bones from contacting each other. So if you don't have this cartilage or it deteriorates, it actually makes it very rough for you to walk. If people have like a slipped disc or herniated disc, it's very painful. So it's one reason, good thing to make sure that you don't have degenerating disc in your back, but they're for protection between those two bones. And that's typically the only place where you're gonna find fibrocartilage. And this is what it looks like underneath the microscope. It kind of looks glassy, but you can also see that there has some um, collagen fibers in there for a little bit of stretching. Anytime you see chondro, that's referring to cartilage, and then site means cell. So looking here, the structure, the function is for weight-bearing cartilage that resists compression, and it also acts as a shock absorber. So if you are running or walking, your body still is going up and down. So essentially, the fibrocartilage that's in your back, these little blue pieces here, are going to compress or resist compression, but also allow for essentially um, for you to have a smoother transition between the movement of those bones. So it kind of reduces compression. And so this is going to be found in the intervertebral disc. So this is in your spine. The pubic symphysis. So this is the two where your two pelvic bones meet in the front. There's a little bitty piece of cartilage that's right there. And then in between your knee, like I said earlier, that's going to be where you're also going to find um, this type of cartilage. It's also to reduce friction. Elastic cartilage, which if you look here, it looks very, very stringy. Um, those are the elastic fibers. And you're going to find this one in your external ear. So if you look at your ear, why it's so nice and floppy is because of um, elastic cartilage. So if you feel right here, that little heart piece that kind of, it can stretch, but it snaps back to its original form. That is your elastic cartilage. And so again, the function is to maintain shape while permitting extensive flexibility like your ear. So when you pop it and move it back and it snaps back into place, that's the reason why it's elastic cartilage. And then another one would be referring to bone. And this is what bone looks like underneath the microscope. And so you have the osteocyte. Osteo is the prefix for bone, and the site is the suffix for cell. So you have bone cells, and then you have the central canals, which is where you will have blood vessels and nerves running through. And yes, you have nerves running through your cells, even though that is a soft tissue. If you've ever broken a bone or hurt someone broke a bone, they usually probably cried because they were in a lot of pain. And that's because you have nerves running through your bones. Also, you have to have a blood supply running through your bones because you have to deliver oxygen in order for those mitochondria to make ATP and the citric acid cycle and the electron transport chain. You have to have a blood supply for that as well. And this whole thing that is called, it kind of reminds me of the rings of a tree. If you've ever chopped down a tree, it looks like the rings of a tree, but those are referred to as the osteons. And so, of course, bones are going to be in the bones of the body, but their function is to provide levers for body movement. So remember, muscles pull on bones to cause us to move. Um, so it supports soft structures. It also protects our vital organs like our liver, our heart, our lungs, the diaphragm, the part of the kidneys. They also are a great source of calcium. So like I said earlier of how our bodies are constantly breaking down calcium if we are deficient in it, when they're also always building our bones back up, making sure that they're staying strong. Our bones are also the site for our blood production. So in the long pieces of bones, which we'll talk about in the bone chapter, in long bones, we are producing our red blood cells, are also known as erythropoiesis. And so blood is also a connective tissue. And this is what it actually looks like. Blood is not just this red liquid. It's actually a many, like billions of red blood cells, if not almost trillions of blood cells just floating in water, which we refer to as plasma, which has our ions in it. Um, but it's actually composed of white blood cells, platelets, and red blood cells, and ions, and water. So it's a connective tissue because it has a lot of different tissues and is able to control and bind to other different tissues as well. And it transports to other different tissues. So it's referred to as a connective tissue. So here you can actually see these little pink dots are really the red blood cells. And these purple ones here are different white blood cells. So you don't just have one white blood cell, you actually have, I believe, neutrophils, leukocytes, or lymphocytes, monocytes, eosinophils, and basophils. So you have 5 different types of white blood cells, which we'll talk about in the blood chapter in A&P 2. But you have a lot more things floating in your blood. Your blood is not just red liquid, it's actually a bunch of red blood cells. And remember, you produce about 3 million blood cells per second. So that's a ton of blood cells that you're producing. So the different types of tissues, when it refers to muscles, there's 3 different types. So you have skeletal muscle tissue, which skeletal muscle sounds like what it actually does. Skeletal muscles are found around our skeleton. So that's going to be the muscle that you find around our legs, around our arms, around our fingers. That is going to be skeletal muscle. It actually pulls on these skeletons attached to the skeleton, but they pull on the skeleton. This is kind of identifiable because they're kind of long, they're multinucleated. They look very, very, the striations of the proteins are very, very nicely lined together. If you look, you see all these little lines together. If you think about when you eat a steak, which is muscle tissue, hope you understand that. When you cut into a steak, you see those nice, pretty little lines when it's cut, when it's cooked, or any meat really. Those are the striations that you're seeing here. Those are those proteins that are folded and organized neatly. So you can always tell skeletal muscle because they are very nicely organized. Those proteins are. And cardiac muscle tissue, on the other hand, cardiac muscle tissue comes from the prefix of cardiac, which is referring to the heart. With cardiac tissue, it looks a little bit different. It's kind of Y-shaped. They also have what's called intercalated disc, which are these little black portions here. We zoom in a little bit more, you can see what these little black portions here are referred to as intercalated disc, which allows for ions to pass through those points between cells really quickly. The reason why they have those is because the heart is always contracting. They're always having to beat. And so it needs ions and nutrients readily available. They need it all the time. So you have to have an easy way to get ions across the different cells and tissue very quickly. So these are what the intercalated disc can do. And it also allows for electricity to kind of pass through the cells a lot quicker too. And then we have smooth muscle. Smooth muscle they call it smooth because it's tapered at the very end, so it looks very fine at the very ends. It looks very smooth. There goes its name. But smooth muscle is involuntary. So that means that I cannot control it. So we find smooth muscle within our intestines and in our stomach. So let's think about this. We don't actually think about digesting our food. That's happening without us thinking about it, right? So that's referred to as involuntary. So if you've ever been sick and you've had to throw up, you may know that when we get ready to throw up, our stomach contracts and we can't stop it. We can try to hold it, but we can't. Usually when you throw up, you feel your whole abdominal area crunch up and it's just like it comes out. because you can't control it. It's that smooth muscles happening. Involuntary means that you have no control over it. So whether you try to hold it in or not, you're not gonna be able to hold it in. I promise you. So also your breathing muscles or your diaphragm, most of it is actually smooth muscle. We don't think about breathing. It happens on its own. We don't really control it. We can hold our breath, but we have to think about it. But right now, you're probably breathing, you're not even thinking about it. Your heart is the same way. We don't tell our heart to beat. It has its own pacemaker and it has its own cell, all the rhythmic cells that are going to tell it to beat. We don't think about our heart beating because if we had to think about it, a lot of us probably dead because we don't ever think about it. The only thing that we actually control are really our skeletal muscles, which we refer to as voluntary. Those muscles we control. We control if we get up and walk across the room or get up and sit down or turn over in the bed. We control those muscles. Those that would be referred to as voluntary. But involuntary are things that we cannot control. So we cannot tell our stomach to contract or start digesting. We can't tell our intestines to digest. Those are controlled by our brain where we can't control it. We can't tell our stomach, okay, start digesting now. Nope, we can't say that. The only thing we have control over is really skeletal muscle. So another type of tissue is referred to as nervous tissue, which is going to be our nerve cells. Um, so this is what the top picture is what they actually look like if you took a microscope image. But here's a nicer, prettier image. And so here's the cell body where all the organelles are held. But here's the axon where the electrical impulses are going to travel down. And then these dendrites are what's going to receive signals. So the dendrites are essentially like antennas. They're going to pull in, they're going to receive information. The cell body is going to interpret that information. And then the axon is going to push out the electrical signal. So the location of these type of nerves in general is really the brain, spinal cord, and nerves. But the function is to receive, process, and transmit nerve impulses. Also, it can nourish other cells as well. So tissues can be found in organs, which organs are structure that's composed of two or more tissue types that work together to perform a specific or complex functions. So like your stomach, your liver, your eyes, your kidneys, they're made of different types of tissues. So if it has more than one type of tissue, it's classified as an organ. So like our stomach, it has different types of tissues. We see that there's muscle tissue, we have areolar tissue, we have dense irregular tissue, smooth muscle tissue, areola down here, mucosal and simple columnar. So all these different tissues are found in your stomach, and that's why it's able to contract. And that's why when your stomach growls, it's smooth muscle contracting, which is what we're actually hearing. You're hearing the muscle contract, which makes a sound, tells your brain, oh, I'm hungry, and then you start feeling this pain. That's due to smooth muscle. You can't control your stomach. I wish, but no, you can't control it. So you also have what's called a mucous membrane or a mucosa. So remember, mucus is for keeping the outside world out. It's for trapping potential pathogens. So you're going to have mucosa in your eyes, in your nose, in your mouth, any open orifice. So the vagina, the urethra, the anal canal, all those are mucous membranes to protect the outside world from getting in. That's why they tell you when you're sick not to rub your eyes or touch your nose or put your fingers in your mouth, keep your hands clean. Is because if you touch those areas, mucus kind of it's a really great breeding ground for bacteria and diseases. because mucus is warm. It's going to be, it has liquid, it has substances like sugars, a little bit, some ions, things that it can actually feast off of. If bacteria can feast off of it, they will start growing and making more of themselves. And so that's why they tell you not to rub your eyes, because then it's going to start making more, get into your bloodstream. It can go to other tissues. And once you affect a tissue, you can affect an organ system, organism, kind of thing. So you gotta be careful with touching your mucosal layers. Well, your mucosa membranes are for protecting you from the outside world. So everywhere there's a mucous membrane, like your eyes, your mouth, your nose, they're open to the outside world. That's why we have mucous membranes. The cutaneous membrane is referred to the skin, which I said earlier, which is um, your largest organ, is your first line of defense. That's how it's able to protect from the outside world. So that's why if you get a cut, why it's so pertinent that you get it cleaned and get it bandaged, so that it can start healing, but also protects it from the outside world. Um, some of the joints are lined by synovial fluid, which reduces friction. So it's composed of a special connective tissue. So it's just the liquid, the synovial fluid that's on the inside of it. Is protecting the fluid. So if you pop your fingers like this, you're actually squeezing the gas out of that fluid. That's what you're actually hearing the popping. You're squeezing, you're causing a lot of pressure, and it's squeezing the gas out of that fluid. That's what you hear, that pop. Um, no, it does not cause arthritis. Um, they've done studies. Now, if you do it like 15 times a day, yeah, you might could mess up your joints a little bit because you're constantly doing it over and over and over again. Um, but just by popping your fingers every now and then, no, it's not going to lead to arthritis. But if you do it like 15 to 30 times a day for, 75 years, yeah, you might do some damage there, but that's not, may not be arthritis. It might just be wear and tear on your joints and cause them to um, essentially go into hypertrophy. All right, so next part is dealing with tissue development and modification and aging. So here is just giving you a diagram of how our cells go from cells to tissues. Because remember, we start from a sperm and an egg, and then you go into what's a zygote once they fuse together. That zygote is going to form three main layers. You have your ectoderm, your mesoderm, and then your endoderm. So your ectoderm is going to form more of your skin, some of the teeth, your lens of your eyes, so your nervous tissues. The mesoderm, I always remember mesoderm because it starts with M. It's muscle. Also, your skin, parts of your skin, your blood vessels, your heart, your kidneys, your spleen. So really your internal organs that's surrounded by muscle. And then your endoderm, which is going to be your liver, your gallbladder, your pancreas, your thyroid, your parathyroid glands. That's going to be your endoderm. So ecto meaning outside, which would be your outside skin. Meso would be like muscle. Then your endoderm is going to be the inside, or your inside portions would be a lot more of your intestines and your organs that's on the inside of you. So there's different types of abnormalities when it comes to tissue development. So you have what's called hypertrophy. Hyper meaning more than abundant. So hyper it refers to increase in the size of the existing tissue. Hyperplasia means that there's a lot more forming. So hypertrophy is just the size increasing, versus hyperplasia means you have a lot more cells being made. Um, Atrophy would be is shrinking of cells. So like when people get older, their body mass starts to decrease, and their cell size starts to essentially decrease. So especially when you have like muscle loss or bone loss, we call that atrophy because the cell size or the cell number is starting to decrease. So for like metaplasia, um, this is essentially where you start changing the function and the structure of cells. So in the book, it actually gives like if you're a smoker or have been a smoker for a long period of time, the byproducts are environmental stressors that change the normal pseudostratified ciliated columnar epithelium lining of the trachea to a non-keratinized stratified epithelium. So essentially, it makes the epithelium or the tissue in your trachea or in your windpipe a lot thicker or stronger. So it kind of turns it into almost harder skin cells in your throat. And it's not supposed to be that way. It's supposed to be pseudostratified ciliated, which means it's supposed to have those hairs that are going to push up that mucus. But after being a smoker for a long period of time, it reduces that. You're not able to, it actually kills the cilia. So that's why it becomes non-ciliated. And so it loses the cilia. So now when you cough, if you've been smoking for a long period of time and you cough, you can't get rid of that mucus. It kind of just stays there and you kind of cough and cough and cough and cough and cough because you got rid of that cilia or you went through what's called metaplasia, which it essentially changes that cell type because you have essentially destroyed it with smoking. Dysplasia refers to abnormal tissue development. So if a tissue is not growing properly and starts growing kind of abnormally, meaning you start like having like a mole or something that pops up, that would be referred to as dysplasia. Now, when tissue starts growing out of control and you start having what's called a mass, that's referred to as a tumor. Sometimes that tumor can be malignant, which means that it has spread, or it can be benign, which is this word right here. Benign means that it's still in the same place and has not moved. But what's the difference? Why is one bad, why is not the other? So if it's benign, means that that tumor has stayed in the same spot and it hasn't moved, which is good because then we can go in there and take it out and get all of it. If it's malignant, it's going to essentially make a tumor and then it starts spreading to other parts of the body. Those cells start to spread. Why is that a bad thing? If those cells start to spread to other parts of the body, those cells will start telling other cells to start doing the exact same thing. And so you start having tumors pop up all over the place. It starts making cells kind of go out of normal. It's because cells are supposed to divide at a certain time, but those tumor cells will start telling cells kind of go rogue and they'll start kind of doing their own thing. They won't listen to anybody else. And so it gets really hard and difficult to try to kill all those cells. So that's why we put them on chemoradiation or chemotherapy. Essentially, it goes into an IV, it goes to all cells, and chemotherapy essentially it stops cells from dividing. It doesn't allow cells to divide anymore. So that's why people's hair will fall out and why their stomachs start hurting is because it stops those cells from producing mucus. And so, and remember, your inside of your stomach replaces like every day. And if you're not able to replace those cells with new cells, that acid starts eating at those cells in your stomach and it causes ulcers. Chemotherapy also, it stops cells from dividing. So your hair, it grows pretty quickly compared to other cells. Well, chemotherapy stops those hair follicles from producing any hair. That hair falls out. That is what happens when you have chemotherapy because it's stopping those cells from dividing. So that's the difference between being malignant and benign. Necrosis is, which we referred to as earlier, so essentially it occurs is due to tissue damage that's not reversible. So here's a picture of necrosis or gangrene. So you're actually seeing dead tissue and it can't come back. So here's a really bad. So once that tissue dies, it doesn't come back, unfortunately. So stem cells, we have different types of stem cells, which we have what's called totipotent, which means total potential, which means they can potentially become anything that they want. Um, pluripotent, um, they can become any tissue layer of the embryo that they can, but they can't become structures such as the placenta. So they're kind of close to totipotent, but they kind of get put in a category to where they can't go back, but they can still become anything else, but they can't do the totipotent stem cells can do. Multipotent, which means they have the capability to differentiate into a restricted number of some cells. So essentially, as they go through these stages of totipotent, pluripotent, and multipotent, they get more the cells get more specific in their function to the point to where once they get to unipotent, that means they can only become that type of cell. So with totipotent, they can become any cell in the body. They can become a body, they can become an eye cell, they can become bone cells, skeletal muscle. They can become any type of cell. But once you get into pluripotent, multipotent, they start getting into a little bit more classified categories to the point to where like multipotent can become any, let's say they can become any type of muscle cell, but now they can't become a eye cell or a bone cell. They can only become a muscle cell. So they only have three categories, which would be skeletal, cardiac, or um, smooth muscle. But if they go into unipotent, they can only become, once they become a smooth muscle, they can only become a smooth muscle. They can't become any other type. They can, so essentially each level it gets more narrow of the things that they can become to the point to where they can only become one thing at that point. So that's one thing about stem cells is that they can become anything until they start getting programmed to be more specific, and then they can't ever go back. They can only become that one thing at that point. So gangrene is actually necrosis or cell death of soft tissues of the body parts. So you have different types. You have intestinal gangrene, which is obstruction of blood supply to the intestines. So if you obstruct any blood supply of any organ, you're going to have tissue to start dying because you're not getting the proper oxygen or glucose. And if you don't get oxygen or glucose, you can't make ATP. Those cells don't have energy. They don't have energy or glucose. They start to die. So in intestinal gangrene, you obstruct blood flow to the intestines, so the intestines start dying off, which is a really bad thing because your intestines absorb your nutrients. If you can't absorb nutrients, you can't get your glucose, and you can't get glucose, everything starts to die. You have dry gangrene, which is essentially where the body part is desiccated or shriveled due to constricted blood vessels again, or exposure to extreme colds like frostbite. Frostbite essentially it gets so cold that it stops your blood flow completely, especially to your extremities, and essentially it starts your cells die so quickly that they can't be replaced. Wet gangrene is bacterial infection that has a loss of blood supply and oxygen supply. So imagine if you have a infection, a bacterial infection, and a big wound. It's anytime you have an infection or a wound, it's heavily dependent on a blood supply because that's how it gets all of its supplies. It gets all of its nutrients. It gets all of its white blood cells to fight off the infection. If you lose the blood supply, you don't have any more white blood cells that can come to that site anymore and actually fight or defend. So now essentially the bacteria is going to start winning and it's going to start multiplying because there's nothing to fight it. So that would be wet gangrene. And an example that would be like staph infections or streptococcus. Um, those would be a good example of those. And then you have what's called gas gangrene, which is where bacteria is going to invade um, the necrotic tissue, and then the bacteria is going to release gases and produce bubbles, which cause cracking. So it's going to sound like popping your fingers, but it's gangrene, which is kind of interesting. So, with that being said, we also have what's called tissue transplants. So sometimes, like for like burn victims, they'll transplant different tissues to repair their skin. Or if you tear a tendon, they may take a piece of a tendon from something else or another human and replace it. So that's also referred to as grafting. So grafting is the process of surgically transplanting healthy tissue to replace diseased, damaged, or defective tissue. So you can have what's called an autograft, which is a tissue transplant from one site to a different site on the same individual. So that's like if I took um, my a part of my Achilles tendon to replace the tendon in my lower leg, or vice versa. It's in the same individual. Center or syngenetic graft or syngenetic graft, or it's also called an isograft, is the transplant from one person to a genetically identical person. So some anytime, usually when you take something from one person, put it in another person, you have to make sure that their bodies are going to accept it. Because remember, each one of our cells are different from each other's. And so our immune cells only recognize our cells. So if you put someone else's cells in our bodies, your immune system is going to recognize that's not my body and going to kill it. And we don't want that to happen when we are grafting or doing a transplant. With an allograft, we have a tissue transplant from one person to another who is genetically different. And um, so skin can be done like this, muscle, bone, and cartilage. Um, but some things such as heart, valves, kidneys, pancreas, and liver, they have to be very genetically close or our bodies will reject it. So some things don't have to be immune specific. Like the cornea of our eye. So be like, I can take part of my eye and give it to another person without having to worry about immune system. However, if I give that person a kidney, I got to make sure that our immune systems are compatible. But there's some organs where we don't have to worry about compatibility with the immune system because the immune system doesn't really reach some of these places. And then lastly, you have a xenograft, which is also called a heterograft. So this is a tissue transplant from an animal to a human being. Um, so I know we can use pigs, cattle, so we can replace heart valves, blood vessels, and bones because they're pretty close because we're all the animal kingdom. But also, they don't really have to worry about essentially causing compromises with the immune system. So sometimes we can take things from animals. So I know some things like if you've ever tore your ACL, they can actually take that from an animal or even a different part of you and actually replace that so that it can heal. Because remember that cartilage are usually avascular, which means that they do not have a direct blood supply. And actually, cartilage actually secretes a substance that actually keeps it away from blood supply. So that's one reason why it's so difficult when you have surgeries on knees or things that have tendons or ACLs because they don't have a blood supply, so they have a hard time getting the nutrients that they need to be able to rebuild. So it just takes longer. They can still do it, it just takes longer. All right, that wraps up chapter 5 for tissues. And it is my hope that you learned something new. I know this was a long chapter, but we stuck it out. And hopefully you understand a little bit more about tissues. All right, until next time, I'll see you then.